my screen?
Yes.
Okay, perfect. So I know it's been a long day for everyone, and we've had a wealth of information, I think, starting from first thing in the morning. So I'm going to try and keep it as simple as possible. There's a lot of information that I wanted to share with you, but I think since you've had a whole series today, I think we'll save that for our hands-on workshop that we plan to do with all of you. And I want to take you through some aspects that I learned myself. In dental school, I think we focus on so many other aspects that when it comes to being a practice owner or the other individuals involved in that is something that we don't really learn out there. So I'm going to run you through very, very short aspects today, and we'll keep it as brief as we can. Something that we'll take a look at that we've essentially learned throughout the day to day are practice goals that we should all be setting up as owners. And we're going to take a look at practice management systems, and then I'm going to take you through a little bit on the workflows that you can expect in Traco. This is something that throughout my career as a dentist and all our friends together, I think this is something that each one of us will agree with. As a dentist, we're always wearing multiple hats, different roles that we have to take on at an office, whether we're practice owners or not. And this is something that I always find very interesting, and I hope you'll agree with me on this. I think as a dentist, we're all part doctors, we're part engineers, and most importantly, we're all part-time artists. And I think that's a beautiful way to put it together for us, because so we have to think and collaborate all these different aspects into one craft in one of the most intimate areas in a patient's body. And all that comes with a lot of experience, with a lot of practice. But most importantly, like some of our speakers earlier have said, I think it's all about effective communication. I think in addition to this, the other hat that gets thrown onto most of us is the concept of leadership, being a practice owner. And I think that's what we've all very integrally learned today. Practice goals. When I graduated from dental school and I was setting up a lot of practices from the ground up, I think through time, initially when you're in dental school, these are not things that you learn. You're more focused on the clinical side of things. But practice goals, setting up practices with the number of people taught me, and especially I like to always give any team that I'm setting up a triad, a goal. I think if we have a triangular concept as well, you have growth always at the top of your triangle. And I think as dentists, the two things that we would always like to focus on are experience and quality. As dentists, quality on the clinical side of things is something we're always aiming toward, whether it be one in our learnings, in our experience, two in the equipment and in the technology that we deploy at the offices. Secondly, experience. I think patient experience is what dentistry today all boils down to. I think in the past, very, very many years ago, patients would definitely look up to dentists and look up to them for whatever they said, and they still do today. But I think today an experience factor is genuinely what causes patients to keep wanting to come back. So it's a two-way street at the end of the day. What about the practice management system? All right, why does this form such an integral part of the triad that I just showed you? Growth, experience, and quality all are the core fundamentals of our practices, and that is what a good practice management system will do for you at its very essence. So when I was thinking about those of you that I know, Abbas did a survey earlier on today about how many of you at what stage you're in, whether you're learning, whether you've qualified, or what stage in the learning process you are in. And I was thinking back to the days when I graduated, and I said, the first thing that comes to mind when we graduate is, are we going to be an associate? Are we going to be practice owners? Like Dr. Neil and Dr. Vic was saying earlier today, I think that is the battle that's constantly in our minds to choose between. And in addition to this, in addition to the big decisions that we have to take the minute we graduate from school. Vic was talking to us about the debt that a lot of us are probably already in. So, when it comes to those aspects, we have so many things going on in our mind that I think practice management software is one of the last things that even come to our mind when we decide to start out. And essentially, what I find amusing is, what I find very interesting actually is that a lot of practice owners have given me this feedback saying we wish that we would have looked into this much earlier. In fact, as given it as equal importance as the other things. So, couple of the things that you guys are definitely going to take back from today, from your all your learnings today, are whether you want to move into being a practice owner or an associate, whether you want to buy or build. Most importantly, expansion and growth. Of course, as dentists, we all want to start out growing, but I think expansion is where we like to go, whether it's one office, two office, or even scaling a single office. Most importantly, the one hat that we were never taught to wear in dental school, or perhaps even certain aspects that we don't realize until we're practice owners, are the key fundamentals of management. The minute you become a practice owner, you are thrown into the field of wearing a hat of leadership. It's not about being just a manager. You have office managers, but as a practice owner, being a leader and taking your team to success is going to be the most important things that you will take back from today. Okay, why is when I talk about the word management? Now, management has different aspects to it. You have, of course, the financial aspect to it. You have the technology part to it, but most importantly, like I was talking about leadership, when you choose to go or decide on a particular program, a particular technology, a practice management system, just like you have multiple partners when setting out your business, whether you partner with the different dentists or you partner with a corporation, everybody as part of your dental business is your partner. But one of the most important partners that you will always have with you from the beginning until the end is your software, your practice management program. They are your built-in partners. They are the ones driving the engine of your practice every single day. So I want to talk to you as a new dentist, right? These were things that I never knew, that I never realized. What is the importance of choosing the right practice management program for you? Functionality. So if you see on the screen right now, I've listed out very simple points for you to just keep in mind what you should be looking at as a dentist when you're choosing a practice management program. Functionality. Like Dr. Neil said earlier today, and Vic as well, it's very important that you choose what's good for you. That is the most important thing. What is the goal that you would like to go ahead with for your practice? Where do you see that? That's the most important thing. So when you're choosing a program, you must look at functionality. Is it functional for you? Is it where you would like to see your practice going? Reporting and analytics. Analytics is one of the most key concepts that you will look to every step of the way once you are a practice owner. When you're an associate, you are definitely looking at reporting and analytics, but that's more from the level of your individual perspective. You aren't necessarily considering all the parameters that are involved in running a practice. So choosing a practice management program that can give you a good integration and intuitive relationship with being able to see where you can go, where you are at right now, where you were in the past, is a very integral part of choosing your program. Different programs have different ways of representing this, but I would always say go with the one that gives you the most intuitive and the most interpersonal relationship with the metric. Secondly, integration. At the end of the day, a practice management program must always give you a holistic perspective, right? At the end of the day, when you're a practice owner, again, I think the pandemic has changed a lot of things, but genuinely, a lot of practice owners are now switching to being chartless. because the pandemic and as somebody said earlier in the day today, infection control has become a huge nightmare. So in light of that, going chartless, going digital, being in a completely paperless environment is your best foot forward, no doubt about that. Having said that, despite the fact that you may choose to go with a particular program, you will still need to use other aspects of technology along with your practice management system. It's going to be the one place, the one system at your office that would need to integrate with a lot of other aspects. So in relation to that, always consider this, the integration that it has within itself. Does it give you different options? And most importantly, how does it work with other programs? Training and support. All right. Training and support are two things as a consistent form of feedback that I get from a lot of offices, because I train and work with a lot of offices Canada wide, and everyone is always talking about how training, as Sean rightly mentioned in the presentation just before mine, he said, being able to set up goals, set up metrics, taking your team forward in a particular manner is always guided by training. But the most important thing is, what are you doing with that training? Are you measuring it? Are you quantifying it? Is it tangible? These are the most important aspects that you should be looking at as a practice owner when buying your program. The support team, they are the ones that your team is going to be calling all the time. So make sure that you have the adequate support and training that you need when going with the program. I'm going to leave this last one out because it's more optional. But in my perspective, as a dentist, as a practice owner, scalability is a key integral part of my decision making when I go with something that is going to be at the core of my practice. Today, when I started out as a dentist, I may have said, okay, I'm starting a practice, I'm going to do one. At that point in time, I think maybe being young, maybe thinking of all the decisions that I had to make, I think scalability was not something that was ever on my priority list. And I think as all of you have taken the big leap of faith in taking this decision to relicense in Canada, and you've already started the process, I think scalability is always a good concept to always have on top of your list. Keep it in mind. It's not when you go with a program that can handle you having multiple practices, it's always going to be beneficial for you as an owner, as an environment, so that your patients can be seen anywhere. Most importantly, for your team, the ability to cross communicate, the ability to just have an integral foundation of it all. This is something that I genuinely do every time I'm working with a practice. Especially, this is a very important business concept that I studied during my when I was doing my MBA. And I think this is something that has genuinely helped me in decision making in a lot of aspects. As a practice owner, or even as an associate, even choosing to buy a practice, these 4 pillars that you see here, it's called a SWOT analysis, SWOT analysis. You'd see it's divided into 4 concepts or 4 boxes. You have strength, you have weakness, you have opportunities, and you have threats. All right. Now, I'm not going to say that threats is something that we can apply to all aspects of our decision making. However, if I were buying a practice, I would definitely look at what are the strengths of the practice? What are the weaknesses? Am I able to, can I live with those weaknesses? Can I improve on those weaknesses? Is it something that I can combat? Opportunities. What are the opportunities that this practice has for me to grow? Most importantly, are there any threats? Is the location a problem? Is the current patient conditioning a problem? There could be multiple reasons. Is the landlord a problem, like people were mentioning earlier today? These are all aspects to evaluate. But most importantly, what I would like to give you as a sort of a route map or a path when you are evaluating a program it's very important that you identify the strength of that program, because the strength of that practice management software is what is going to be the driving force behind your practice. It's what's going to keep your patients coming back. It's what's going to keep your staff happy and excited, because they will not have to involve themselves in too much duplicated effort. It's also important to analyze sometimes what are the drawbacks or what are the weaknesses that the program may have. And a lot of times you'll find that those are things that you can combat, you can overcome, but at the end of the day, it's always your decision. But one of the things that I always look at is the opportunity. And I think genuinely with Tracker, that's something that I really like, because the opportunity with Tracker is endless. Whether it comes to internal marketing within your office, your patient referral system, whether it comes to external marketing, whether it comes to your reputation management, which is a huge integral part of starting your practice. I think Tracker genuinely brings all of these together. And likewise, when you are doing your due diligence, this is something for you to keep in mind. All right, little bit about Tracker. Okay, as you set off to launch your practice, to launch your careers here, I think it's important that you realize each one of these programs, or especially when you look at Tracker as your program of choice, what I genuinely like about it is the fact that they have tailor-made solutions that are built for you through years of interacting with different dentists. One thing that I wanted to mention, in addition to a strength while choosing a practice management system, is matured technology is always important. Whether you're looking to buy a television, a cell phone, it doesn't matter what you look at. Matured technology is extremely crucial in your decision. But at the same time, for me, the defining point is not only about mature technology, but also about consistently evolving technology. So I would always go with a practice management company, especially like Tracker, that's always consistently evolving their technology, taking the opinions of dentists and always integrating it into their program. Tracker was founded in the early 1990s, and they have been bringing over 20 years of expertise in enhancing the way dentists interact with patients, in the way they treatment plan, in the way they handle case acceptance. And Tracker is a truly beautiful program for both chartless offices that they have multiple ways that you can genuinely be paperless, as well as Tracker has a lot of offices that are still using paper charts, but of course, they are exploring the way to move forward to be chartless. What are the pillars of Tracker? Now, to be honest, this is something that I like to get creative about, and I'm very proud about these aspects that Tracker can bring to its various clients, to the various dentists that they work with. I've divided Tracker right here into the different aspects that they are strong and something that would be most important for you in terms of decision making. All right. The training and tech supporting, being part of the training team myself, I can say that with the feedback we receive is absolutely phenomenal. And I think we take pride in that. And I think that's the backing that a lot of offices like. And I would definitely recommend that it doesn't matter who you're choosing, but at the end of the day, go with a team that can provide you with adequate training and with the backing that you need to systemize and centralize your operations. Most importantly, the support team, like I said, is going to be your go-to. I think resources. At Tracker, they handle a lot of webinars. They do monthly webinars. I do a lot of the webinars. They have a lot of blogs, articles. So I think literature library is very important as well, to be able to have your team quickly go and access information. Tracker's always there. If you choose to want to play around with it ahead of time, they give your office a different variety of options. I think the tools in Tracker that truly are remarkable are the administrative and clinical capabilities. They have beautiful integration, and I think you will truly enjoy that. Most importantly, I think in today's day and age, patient engagement is extremely important. And that is one thing that you will find Tracker being a complete project for you, because it encompasses everything that you would need to run your office without necessarily having to have different programs to do one function. So if I summarize all of them into a quick nutshell, I would say these 7 points to all of you who are studying, looking to buy programs. These 7 points are going to be your go-to when you look at any program. Any program that you look at, I would say these 7 points is something that you should always consider. This is what's going to determine your practice operations. Okay, I know that you've had a long day, so I'm trying to condense all the information that we can. If you have any questions, don't hesitate to leave them in the chat box. Those of you who would like to stay back at the end of the session, we can always go through them. Patient workflows. Why is this crucial to your operations? All right. Now, we're going to take a look at certain administrative abilities that would be crucial when you take a decision on your practice operations. Number one, need versus want. This is always a battle in our minds. What we need versus what we want. And I think when it comes to practice operations, it's very, very crucial that we amalgamate these to have the best tools available to us. Because like I always tell a team, whether I'm setting up a new office or an existing office, I am always telling the team, and more so, I'm always telling the practice owners, your team can only be as strong as the ammunition that you provide them. So when you provide them the tools and the ammunition that they need, that is what works best. And you'll often notice that they're a lot happier and when they're able to function better with a specific program rather than a program that might be a bit inhibitive for them. So let's talk about building and optimizing the schedule. All right. I think as practice owners or associates, most of you will understand the value that an open schedule, or rather a value that a schedule brings to a practice. If we, as an associate, if you were at an office and you had a completely packed schedule, but all of a sudden you had a cancellation, it sort of kind of tears our day down a little bit, because we went with a plan, we went with an agenda, and sometimes when the schedule falls apart, it takes away from the goal that we had for the day. And that's why I think, like some of our speakers were mentioning earlier today, it is so important to be able to optimize your day and essentially at a practice, optimize your schedule. With a program, with a practice management program, your administrative team should be able to put your schedule back together, quickly fill it up. Let's say with an appointment or with an appointment that was canceled, they were able to bring in somebody because they had a specific list to go to. So as practice owners, as associates, this is something that you will always want to keep in mind. A program that would allow you to build and optimize your schedule at any point in the day. Financials. I think we spoke a lot about financials today. And at the end of the day, financials is something that we can learn about, we can study about. But the most important part about financials is being able to track it, and track it accurately, track it daily. And having a program that's intuitive enough to give you the information you need to be able to review and relay data and compare them is the most essential need for you as a practice owner. I think as a dentist myself, what I often have found that when we get into our gear for the day, when we get into that zone, chair side, we completely are so engraved and intrigued by the work we have to do. Sometimes it's difficult to switch out of that and look at the other aspects of things. And that's why I think it's very important that you have a system in place at your office to be able to track these financials or track these aspects. And that's why management system is very crucial. Accessibility to patient data. Okay, from the hundreds of offices that I have trained and I have worked with, what I have come to understand over all these years is accessibility to patient data. Time is money at the end of the day, at any point in our lives, especially in a dental office. When we have a full schedule for today and one cancellation offsets our goal, maybe our production goal, our production forecast for that day. Being able to access information quickly, being able to fill that gap, most importantly, your administrative team to be able to quickly check in and check out a patient. That entire process has to be a smooth line transition. And that is why using a program that gives you quick accessibility, and when I say quick accessibility, I mean as a practice owner, you should be looking for programs that bring the information to you as opposed to your administrative team having to look through information more often than not. Want. When we talk about want, I think everything that I spoke about in need basically draws a parallel to what we want. We want our staff to be productive. And at the end of the day, we would rather they spend less time on having to manually do things and have them spend more time with our patients, increase patient interaction, and more often ensure that the schedule is kept intact. I think a practice management program is equivalent to having a well-oiled operation at your office, right? You want the flow to be smooth. From the time the patient walks in to the time they leave the practice, you want to make sure that it is a well-navigated and rounded approach. Most importantly, I think each one of us, from what we've heard today and what you've mainly heard today, our ultimate goal of a practice management program is to ensure we are building our patient base and increasing our revenue on a day-to-day basis. Okay. Something that I am completely a firm believer of when it comes to practices and setting up practices, and when you have your own practice, we have to be able to standardize our operations. Standardizing operations is very, very important. That is what allows for consistency. That is what allows for tangibility and gives you as an owner the ability to measure and look at and compare apple versus apple. Centralize. You know, a lot of times I have found offices they have to look for one piece of information in 5 different places. And that is time consuming. At the end of the day, your process with your practice management program has to be set up in a centralized location. Within your practice management system, you should be able to view anything related to the patient, have the information brought to you in a centralized process. More importantly, at the end of when you are able to standardize and centralize your operations, you need to be able to appraise. Like Sean rightly said, we can do things, we can put things in place, but most importantly, we need to appraise them. How are they doing? We need to check in on them, because there's no point of just setting things in place, but never following up on them. I'm going to talk to you a little bit about recall management. All right. As a patient workflow tool, recall management, you'll notice you don't want your patients to have a flying visit. And you'll see I've put a little aircraft on there to indicate that you want to be able to retain your patients. You do not want them to be leaving through your back door and you not knowing about it. So recall management is a very important patient workflow tool. All right. Your office needing to have a complete list on your hygiene patients, being able to follow up on them. Most importantly, what I understand with offices is no matter the amount of communication that we try and we attempt for, because the goal, like we've learned today, and like you will continue to learn in the future, is every patient must always leave our practice with a future booked appointment. That is possibly not always the case, and your practice management program needs to give you the ability to manage those follow-ups in a very centralized process. Okay, financials. We spoke a little bit about financials, but when it comes to reporting, when it comes to collections, I think as a practice owner, when I go into a practice, one of the first things that I always look at is the production and collection summary. If you look at a collection report and versus the production report, that itself would tell you the health of the practice. So it's very important as a practice owner that you look at a management level from a bird's eye view of the health of the practice based on the production and collection perspective. This is a very basic standpoint. There are many other metrics that you can use, but this is something that you should use, especially with a good programmatic system. Predeterminations. This is something that I always find offices struggling with. They have huge binders of information, folders and folders of information of paperwork that patients need to be followed up on. Staff gets so overwhelmed, and they unfortunately sometimes feel that they do not have enough time to follow up on predeterminations. So pre-Ds is your potential that you are actually giving away when they're not followed up on. Because predeterminations is something that when your office sends a predetermination for a patient, let's say for a treatment plan, it could be for an implant treatment plan or for a bridge, they send it in as a pre-authorization to the insurance company, but the information never comes back to your office for major treatment. And it's up to the office to be able to follow up with the patient. So instead of having binders of information, something that I genuinely like about Tracker is the centralized process that they have for managing pre-Ds. It's a quick follow-up. It's a centralized process. It's easy for your administrative team to quickly find patients. They can sort even by treatments that they need to follow up with. And most importantly, predetermination follow-up is a tool that can even be automated in Tracker. Okay. I think we'll talk a little bit more about treatment planning a little later, but most importantly, treatment planning is something that we would be focusing on during our hands-on workshop. When you decide as a practice owner that you would like to be truly paperless, truly chartless, labs and referrals form a very integral part of that process. And in light of that, labs and referrals are something that I find a lot of offices tend to leave out of the equation. I say labs and referrals also need to be maintained as a centralized workflow tool for your patients, whichever program you choose. And I think that's another tool that I enjoy in Tracker because you can centralize all these processes. The next thing that I wanted to ask you about is, how would you like to be greeted? All right. I want some of you to open up the chat box. I'm going to try and see if I can read that. Let me know, how would you like to be greeted anytime you go somewhere? Likewise for your patients. I think I'm going to look at the chat box. Okay. So I want you to let me know, those of you that are on the session, how would you like to be greeted? Would you like to be greeted with a smile, or perhaps not so much? Somebody who's not really liking their program. Okay, so I think that each one of us, wherever we go, even if it's in different aspects of our lives, I think we always like to be greeted with a smile. And this happened very recently. I think a couple of months ago, I was working with an office manager, and she was giving me feedback on how prior to moving to Tracker, I think her team were always stressed out with the number of steps that were involved in finding patient information, if they had to look up appointments, if a patient suddenly walked in, and so they were always permanently stressed, and as a result they stopped smiling. And patients started to notice that, and gave that as feedback. And she was telling me that amongst all the other aspects that they enjoy with Tracker, one of the things that they enjoy the most is their administrative team being relaxed and enjoying the program because of the information that it brings to them. So that was something just to lighten up your mood. And the next thing that I want to talk about is clinical. And I think Tracker as a program brings us just generally a comprehensive clinical package. What are some of the things that you would need to look at in a program, in a programmatic level from a practice owner when you're looking to buy something? Perio and restorative charting. Okay, if your goal is to be chartless, you would want to be doing your charting digitally. Imaging, very important. You want to make sure that the imaging programs you choose are compatible. Tracker has their own imaging program as well, which is what a lot of offices use, and they really enjoy it because with the imaging program, you actually get to be able to map your images, your x-rays that you take, or the intraoral photos that you take, you actually get to map it onto the odonogram. So if we have time after the session today, I'll try to show you that. Most importantly, document management. When you have letters or documents that you need to scan in, it should be something that you as a dentist can access from one screen. You should not have to disrupt your workflow by constantly clicking out of multiple screens, having to not be able to view your odonogram, not be able to view the x-rays. These are tools that you should all be able to view in one screen for ease of treatment planning and for ease sometimes of even being able to present a case. So wireless photography is something that Tracker has come out with as well. They have photographs, they have a device that you can use, and those images, the minute you use that device, automatically transfers into your patient chart in Tracker. Patient education. This is a beautiful tool which I find a lot of new practice owners using now, especially a lot of them that are opening practices now. There's a patient education tool that you can open up in the odonogram with your patient and play videos about what might be a decay. How could we explain what a decay might be? Something that I always faced as a dentist is when I would diagnose a decay, my patients would tell me, but I don't feel any pain. Why do I need to get it done? Right? When I don't feel pain, why do I need to get something done? Right? So it's very, very important that along with the conversation, like Angie mentioned, that you have with your set of patients, what you tell them, it's important that you focus the conversation towards the need for treatment and also make them understand through patient education tools like they have in Tracker, through videos, through images, what exactly is going on within their oral cavity. I think one of my favorite videos on the patient education tool is about bridges and implants. And I think that's a real winner in terms of case acceptance. Case presentation. When I was in dental school and when I graduated, every case that I would do, of course, we're all very proud of it, whether we do a veneer for the first time or even if it's our first class too. I think most of us as dentists can definitely relate to that and remember that. And I have a huge album in which, you know, you'd have your before and after pictures and your Invisalign case presentations. As you grow as a dentist in Canada, you will want to build a gallery, a portfolio, right? And why do it on paper or why do it in a hard copy when you can actually do all of that in Tracker or in a program in a management system? You can develop case presentations within Tracker to show your patients before and after pictures. Is you could use this when proposing major treatment, when doing ortho, when doing Invisalign. It is one of the best tools to use on the Tracker, charting and imaging side of things, and I genuinely enjoy using that. One thing that I find a lot of hygienists as a practice owner, you're definitely going to want to listen to your hygienist for feedback. you'll obviously know from the statistics that a lot of our practice revenues and a lot of the engines of our daily schedule are driven by hygiene. That is a retention factor. And a lot of hygienists enjoy using the voice automated feature through which they can chart without having to, use one hand and, have infection control issues. So it's very easy. They use this feature and they genuinely enjoy it. Something that I really like is the GPS tool that Tracker brings. You're able to actually track your patient, which chair they're in, which op they're in, which dentist they're seeing, if they've switched from seeing the dentist to the hygienist. It's a very interesting tool, and I found that a lot of admin team members find this useful because sometimes maybe they just have a walk-in and emerge, and there's no empty chair. But this tracking tool actually gives you the ability to see when a chair is occupied, when it's not, and it gives you the ability to move patients around. Maybe somebody's running late. Maybe you had a case for 1 hour and it's extending to an hour and a half, and you now need to accommodate your next patient. So that's an interesting way to utilize that. And hygiene checks. Like I said, hygiene is always going to be one of the important factors that we always look into. All right. This is something that I firmly believe in, and I always discuss this with every clinical team that I work with. When it comes to being a dentist or being any clinical hygienist or dentist, when you treat a disease, sometimes, let's say, if a tooth is missing or if it's a decay, sometimes we win, sometimes we lose, right? But when we treat a person, we will always win no matter what. And I think through my multiple years of experience, I feel that a practice management program, the right one for you, always plays a very integral role in this. With you being at ease, being able to focus on treatment planning, on case presentation, on diagnosis, and allow Tracker or allow the program to do things for you, this gives you the ability to focus on treating the person, and you will always have a win no matter what. I don't know how many of you have seen this movie. This is a beautiful quote from the movie Patch Adams, and it had Robin Williams in it. It's a nice movie, for those of us. You can take a watch. Okay, KPIs. All right. We've spoken a lot about admin. We spoke a little bit about clinical. KPIs. All right. And KPIs form, like Vic was mentioning earlier, a very integral part of our measurement, our tangibility. Okay. The key performance indicators. What are we genuinely looking at a goal, and how are we moving toward that goal? Okay. How are we doing on time, Abbas?
I think we got 9 minutes.
Okay, great. I'll make sure to wind up. I know everyone's probably really hungry and tired. Okay, so Tracker Metrics is a really interesting tool that you can utilize, especially when you want to set in certain goals. You want to set in forecasting goals. You want to make sure you're able to measure your forecast for production versus what you actually achieved. It's a great Tracker Metrics, actually gives you a graphical representation of that, and it's a beautiful way. Patient growth and retention. Remember, you can have consultants come in, you can have the best equipment, you can have the wow factor, but at the end of the day, if you're not measuring your patient growth and retention, then there is no way that we're able to assess where we were versus where we're going. A lot of times when I go into an office, I always use one of the Tracker Metrics to identify what is the potential treatment lying on the table. How many pre-Ds are just lying there that have not been followed up, right? So the Tracker Metrics to analyze your treatment plans are really blow my mind a lot of the times, and I really enjoy it. I think at the end of the day, what's an important metric for me, and I think for you as a dentist, it's very crucial to always understand one of the key metrics at your office is called ARPP. That's just my short form for it, but a lot of times it's called differently, but it's your average revenue per patient. All right. And I did a big case study on this as my thesis as part of my MBA. And ARPP is a very, very key term that you will want to understand. That is, ARPP gives you a statistic on every patient walking into your practice is estimated to give you at least, let's say, $10,000 over the course of their term with you. All right. Or let's say $20,000. So there's a figure. I know we went through a lot of figures today, and I'm not going to bog you down with numbers right now, but this is a key metric and you will really enjoy using these aspects.
If I remember correctly, Vic mentioned, I think
He did.
$1,000 was.
He did. I was just giving you an example. He did.
Just trying to test my memory. If I was attentive enough.
Okay. Let's say, for example, patient engagement. Okay. In today's day and age, patient engagement has become a very crucial and integral part of your experience that you give your patient. I've had a lot of offices tell us that their patients are wanting them to text them. Their patients are wanting to be able to book online. We are really moving away from the traditional ways that we're used to, where we call patients or patients call us. Patients want ease, efficiency now. They don't want to have to wait to call you. And I think that is where Tracker brings in a lot of beautiful technology that they have developed, and it's all integrated into one practice management system for you. All right. So if you would like your administrative team to focus more on patient care, which is what you would like, focus more on them building your schedule, having a system to handle all other aspects for you is important. What are some of the systems that you should look at as a dentist? You should look at having your admin team not necessarily handle confirmations. That should be done automatically. With COVID right now, the number of offices that were manually having to call patients every day and screen them, it was eating into their time, leaving them no time for follow-up on patients, leaving them no time to book appointments. So Tracker gives you all these tools along with two-way texting. As a dentist, what do I love about two-way texting? Sometimes you may want to quickly follow up on a patient after a surgery. Ask them how they're doing. Ask them how they're feeling after maybe the extraction. So the two-way texting tool allows you to even handle post-op care, which I think is pretty good. And one of the features that are really skyrocketing now in terms of favorites is Tracker's online booking tool, through which your hygiene patients can book their own appointments. Most importantly, like I told you at the beginning, one of the opportunities to look for in a practice management program is its ability to grow your practice, not only in the aspects that we've just spoken about, but also in your patient base. And Tracker allows you to integrate website booking, integrate new patient booking into your website. So that's a beautiful tool. So patients can book appointments on your website, and it would automatically integrate into your Tracker schedule. So with all these automations and with all these aspects, I'm going to wind down to the last part of my presentation now, which talks a little bit about reporting. Okay. No matter what processes we set in place, what protocols we set in place, measuring them is the key to success. So there are some nice tools that you can use in Tracker to measure your daily audits. I usually train every office. When we set up a particular flow of operations, we always train them to be able to use these audit tools. It's important to know how many of your patients today for hygiene left without booking a future appointment. How many patients canceled today and didn't book back? Angie and some others were talking about the morning huddle. Tracker has a lovely morning huddle feature which gives you quick information about patients coming in today. And you can utilize these to genuinely, streamline your morning meetings as well. Because in a dental practice, what happens is that everybody works in different shifts. So Tracker's morning huddle tool actually is like a minutes of the meeting. And you can look at that tool. Anybody can see it at any point in the day. These three reporting tools are going to be, as a dentist, what you would definitely look at, let's say as day end and month end reporting, but this is more from a very basic level. The metrics, what we discussed, is more at a high end level. I think with any program that you choose, with a practice management with a practice management program, we need as a dentist to have the ability to visualize what we're doing, whether it's admin or clinical charting. We need the ability to actualize it, right? And the tools to actualize it within the program. And most importantly, the realization always comes in the form of revenue and new patients. So that's it for me today. And thank you very much for joining us. I think at the heart of everything is going to be your team and the way you choose to set things up. So thank you for joining us today. I think, Abbas, if I'm right, we will be having a hands-on workshop for the participants, and we'll do more hands-on and more intuitive learning back then.
Yes, I think the subjects that we discussed today overall are very much interrelated and integrated, and we obviously the different speakers were addressing in their own different way, but the idea was to bring it all together and
Right.
eventually deliver a more integrated program which we are working towards. And yes, a hands-on workshop for small groups will is the next thing that we'll be hosting shortly. We'll be announcing it to all of the registrants and obviously even outside all of our network. So that was an amazing presentation. I think a bird's eye view of what dental
Yes.
software generally is about. But obviously with so many other software on the market, people are looking to always compare one,
Absolutely.
and people who've had experience with one would probably be more keen to look at the other options, because once they understand better what they like and what they don't like about what they have, it makes that engagement more meaningful. And that applies so much to the new dentists
Yeah.
who are either on the verge of starting associateships or buying practices. So they need to understand how the software works as much as those who are starting off and are currently working as assistants, front desk, and in different roles.
Yes. And I think those of you that are currently working in different roles, this is the best time for you to even explore the different programs that you can work with. And always remember, always get a demo of a program before you make a decision. Learn more about it from their team. That's what will help you take the right decision.
Wonderful. Thank you, Jessica. Thank you.
You're welcome.
I think I'm running out of breath and
Yeah.
throat is drying up. So it was amazing having all of you, and I look forward to another slightly. Thank you.
Okay, bye everyone. Thank you very much.